Today, I have a special guest with me, but before we get to that, I just want to introduce myself. My name is Kimberly McIntyre, and my company is Entire Healing because I believe that we can do that. We can heal entirely. And today, we are talking to a dentist who is out in Utah. Her name is Dr. Jorgensen. I want to thank you so much for joining us today and for sharing some amazing information. We're going to be talking about the dental gut health connection because a lot of people don't identify what's going on in the mouth with what's going on in the body. A lot of times, what I hear people say is, I have dental problems because I eat candy. And so they're thinking in their mind, they're thinking what's going on in here. But I'm going to stop talking, turn it over to the one who knows a lot more about this than I do. And first of all, will you tell us a little bit about yourself and your practice and what you've got going on?
Yep. And, people are always a little wondering about how to introduce me. And they'll say things like, are you a holistic dentist? What do you like to use? And I always just say, well, let me just explain it. It's a little easier, I think, if I explain it. I like to start with my story because it really helps to understand where I am now and how I got here. I'm a general dentist and I practiced with my father for many years. He's a general dentist as well. I have three brothers that are dentists. It's just kind of what we do as a family. And I've watched my father. He is a phenomenal dentist. He's well researched. He's state of the art at the head of his profession. And I just thought I would just be like him. We just continue practicing just like that. And that's not how it worked for me. At about 10 years into practice, I started getting really sick. Didn't know what it was. And that really, anytime you start having major symptoms, you have to start looking for answers. Obviously, this was really changing my life. So I started looking everywhere, every doctor, MRIs, blood tests, everything I could possibly do. And everyone said, you're just fine. Go to a chiropractor. Basically, I was having a lot of numbness. I was having so much numbness in my hand, I wasn't able to hold instruments very well anymore, which that doesn't work if you're a dentist. My memory was just really, really shot. And I've always had a really good memory. So I could tell things were wrong. I couldn't remember patients' names. I couldn't remember all sorts of things that I had always been able to remember. And then my gut was really struggling. I just couldn't eat almost anything. So, I changed my diet. We changed a lot of things here at home. It still wasn't getting better. So I actually had my practice for sale because I didn't know that I was going to be able to continue practicing. And I was talking to another practitioner and he said, you sound so much like me. Have you ever looked into mercury poisoning? And I hadn't even thought about mercury as a potential problem. In dental school, they tell you that the fillings that are in the mouth are mercury or have mercury in them, but they're completely stable. They're inert. They're not problematic. There's no issues with them. And so, I told him, I said, well, I don't have any mercury fillings because that's the only reason I knew he would be asking that. And he said, it's not the fillings you have. It's the ones you've been drilling out with no protection and breathing in all that mercury that's been released. I'd never heard a thing about this. And so I just said, well, okay, I guess I might as well get tested. There's nothing to be lost in that. Got tested and off the charts mercury levels. So all of a sudden, all my symptoms made sense because mercury is a neurotoxin. So it affects your nerves, your numbness, brain. It also affects gut health, basically the way that we make stomach acid. Mercury interferes with that. So I wasn't able to make stomach acid. I wasn't able to digest my food properly. This shows up as IBS and all the words that we know, but we don't take it back to, well, what's the reason that this is happening? We just go, oh, it's IBS. Once we have a label for it, we just go, oh yeah, we're done looking now. Well, no. Why is that happening? So found out it was mercury. Took years to really get that out of my system, but I had to figure out, could I actually not get more in me? The doctor said, well, I can help you, chelate this, detox it, get it out of you. But if you keep putting it in as rapidly as we're removing it, you're never going to see improvement. So I had to figure out, was there a way to remove the filling safely without breathing it in and still do my job and get better? So I found an organization, didn't know they existed. They have an entire protocol that's already created for this to remove mercury fillings without the dentist breathing it in or the dental assistant or the patient getting it into their system and getting more sick and more mercury exposure from that removal. So I started doing it. And when I started doing it, patients noticed because it's very different than what you're used to. Like when you're covered head to toe and the doctor comes in with a mercury respirator. And so patients were like, well, what's going on around here? And so then I'd start describing to them, explaining to them, well, I found out I was really sick because of mercury. And so I can't breathe it in anymore. And so this is why we do what we do. And they all started being very interested, like, oh, wow, can I be sick? Like, I'm so glad you're doing this for me too. This is awesome. And then they'd say, well, I have a doctor that's super interested in this. Can I tell them about you? And we started having doctors reach out, and doctors started educating me. So they would start saying, hey, we've also heard the root canals could be a problem. What do you know about that? I'm like, well, I really don't know anything about that. So I'd have to go look and learn and research and find out on my own. They would say, hey, do you use ozone? We hear that's a really good thing. I didn't have a clue what ozone was. So I'd had to go find a course and look and learn. And eventually what I realized is there's so many connections between dental health and oral health in many ways. You and I, just even before we were on this recording, brought up a few. So many connections. And I wasn't aware of them as a dentist. The dental profession isn't aware of them in general. So I really started looking at this saying, wow, dentistry can affect health. So we started calling ourselves holistic dentists, because that's what people know it as. However, if you say the word holistic, people start to get some visions in their head of what you're talking about. They start to think tie-dye and incense burning and a lot of hippies, and that kind of thing going on. And it really made it difficult for me to share what I was doing, because as soon as I said the word holistic, half the population just went, psh, psh, not interested in that crazy talk. And that's not what I'm doing. Like, what we're doing is so scientifically based. I am ahead of every dentist. I have to research because I have to be able to explain why I'm doing what I do to everyone. So I have read the latest research in every single one of these disciplines. So I am not just some hippie that's doing it, because I feel like it, because it makes me, that's not what it is. It's very, very scientific backed. And so that's why I started calling myself a health-based dentist, because we look at health and we say, how can we influence it for good or for bad? And how can we actually, through our dentistry, help people to be healthier? And so that's why I call myself a health-based dentist now. And our practice has grown many times over. We have seven dentists there in the practice now. We're multi-specialty. We have surgeons and pediatric dentists and sleep and jaw specialists, and we care for people all over the world, because they found people are finally realizing that dentistry has a huge impact on overall health. And if you're suffering with chronic health conditions, you really need to look in your mouth and see if there's a component.
As we're talking about gut health and people who have a lot of issues and they have a lot of cavities and things like that. Talk to us about how that can really be remedied by cleaning up just basically what they're eating.
A lot of times people think, okay, cavities are just because I'm eating sugar. That's what we've been told. And this actually goes back to the 1930s, when there was an organization that decided this is what cavities are from. They looked at a whole bunch of different research, and there were basically three main camps. There was the camp that said, eat sugar, bacteria eat the sugar, you get cavities. Then there was the camp, that's the one that they voted on, and that's the one that we've all been taught. And there's another camp from a Dr. Weston Price, which anyone in the nutrition world has heard of Dr. Weston Price. He's a dentist. He was the head of the American Dental Association Research Department. And he actually went and spent 10 years of his life researching how does diet affect overall health. But as a dentist, he was looking primarily at their facial health, oral health, dental health, but then he was looking everywhere as well. His research has really stood the test of time. Like, people have not, they've not been able to contest what he learned. And what he learned is that there were ways to create cavity resistant teeth 100% based on what you were eating. Not only cavity resistant teeth, but very well formed faces where you don't have to have braces and crooked teeth. I mean, a lot of things that really were based on nutrition. So that was the second camp. They listened to him, but they didn't vote it in as the reason. And then the third camp was actually hormone based. And there was all sorts of research showing how hormone fluctuations change the way that the tooth itself operates. There's literally a fluid flow inside of the tooth. And when hormone changes happen, the fluid flow reverses and it pulls things into the tooth and leads to rapid decay. Well, if you've ever been pregnant or have a teenager, or you know that you've heard stories about these teenagers who come in and they have 16 cavities in one visit, and you think, what in the world just happened? Hormone changes, pregnancy, menopause. We'll see big fluctuations in tooth health. Why? Hormone changes. So We look at all of these things and put them together and say, okay, it's not just sugar. Sugar actually is important, but most people know about that. Most people know to brush your teeth. So why are people still getting cavities? Well, there's a few different things. So nutrition is a huge one. And the thing that most people are missing is something called fat soluble vitamins. And this is what Dr. Weston Price found. So fat soluble vitamins are vitamins A, D, E, and K. And the trouble is they're actually harder to find in our diet today. They're found mostly in animal products. And so if somebody is vegan or vegetarian, they're probably going to be very deficient in these vitamins. They're going to have to supplement no matter what. And these are the vitamins that actually help minerals get deposited in teeth. So without those vitamins, you don't have teeth that are resistant to decay. With those vitamins, you literally, I had a brother who I swear didn't brush his teeth for 3 years. He never has a cavity. He's never had a cavity in his whole life. So we know that just brushing your teeth isn't the entire answer. And I see it every single day in practice. I'll see somebody whose teeth are meticulously clean, and yet they have cavities. And they say, every time I go in, I have cavities. So nutrition is one, but there's another piece that involves nutrition that I think is really important. You can eat all the best food you want, but if your gut actually isn't active enough to metabolize that food, or if there is a lot of leaky gut issues and those metabolites. So what I'm talking about is when we eat food, the stomach acid, the acid in our stomach actually breaks minerals apart, breaks the bonds of minerals and ionizes them so that the body recognizes them as a piece that it can absorb. If we don't have enough stomach acid, the body can't do that. You can't ionize the minerals and they end up going through the other end and you don't actually get them into your system. Same thing with proteins. That stomach acid breaks proteins apart into amino acids, which are the absorbable, recognizable piece of a protein to our body. If we don't have enough stomach acid to break it apart, then you have undigested proteins going through the system. This is often what causes leaky gut. The body goes, I don't know what that is. It's an enemy attack. And then we get all these food sensitivities. And why do people have so many food sensitivities to gluten, to dairy, to eggs? They're all big proteins. People usually don't put these pieces together. Those three are all really big proteins. If the body can't digest the protein appropriately, you're going to create a sensitivity to those big proteins because the body doesn't know what to do with them. So we have to be able to digest the food properly. And I often will see cavities. If I see a lot of cavities in somebody and they're new, I look at them and I say, what's going on with your gut health? And they're like, how did you know? Well, because if you can't get minerals from your food properly, your body will steal minerals from your bones and your teeth to help take care of its essential functions, like running your brain and running your heart. So you're going to start to get cavities because the tooth itself will sacrifice itself. It'll sacrifice the minerals to the rest of the body because you're not getting them through your gut. So anytime you're getting a lot of cavities and you're taking care of your teeth, you're brushing your teeth, you're eating decent, it's gut. You need to look at absorption. Is your gut actually absorbing the food that you're feeding it or the supplements that you're feeding it? So that's where we start with a lot of people. And we have a really easy take-home test. You probably have done it too. We recommend it's a baking soda test, we call it, where they take a 1/4 teaspoon of baking soda, 1/2 cup of water, drink it, see how long it takes to burp. And you should be burping in 2 to 3 minutes, I tell people. If you're not, you have inadequate stomach acid and you are not breaking your food apart properly. So this will often show up, like I said, as sometimes digestive discomfort. It'll show up as IBS symptoms. It'll show up as leaky gut problems. And you're going to get cavities in your teeth.
If they don't pass that test, then what do you recommend for them?
So the first thing we do is we start supplementing that acid. So it's betaine is what it's called. It's stomach acid. It's derived from beets. And we do a combination of betaine and enzymes together. And I tell people it is a Band-Aid. It is simply a Band-Aid. It's not fixing your problem, but it's going to help you absorb the nutrients you need to start fixing the problem. So, you can take all these gut health supplements, but if your gut actually isn't absorbing anything, you might as well not take the supplement. It's not doing any good. So you take the betaine, which is the stomach acid and the enzyme, I tell people along with every bite of food and along with every supplement. Otherwise, it's really only absorbing what you're taking that with if you really don't have enough stomach acid. So that's the starting point. Then you start working on probiotics. So we have a special recommendation for probiotics that we use and also gut lining support. So all sorts of specific nutrients, marshmallow root and aloe and things that combine together to rebuild that actual stomach lining so things can't get out anymore. But you've got to start with the acid. If you don't start with the acid, none of the other things you do actually will really do much good for you at all.
Do you sell these supplements?
We do.
Do you have them on your website?
Yep. I have a whole gut health line actually that is
Okay.
just basically walks you through phase 1, phase 2, phase 3.
Okay, so I'll link that below.
Yep.
I'm going to link all of her information below, by the way, just so you know. Can you tell me, do you have fluoride anything in your practice?
No, we do not. So let's
Okay.
talk about that.
Yes.
The reason fluoride started being used is actually part of about the same time contemporary with Dr. Weston Price. They were finding that people who had well water that had high levels of fluoride had more cavity resistant teeth. They didn't also notice that the teeth were really unsightly and they were splotched with white and brown splotches, but they didn't get cavities. So they looked at that and they said, all right, we can identify that high fluoride levels actually lead to stronger teeth or more cavity resistant teeth. So the government, in its all knowing, all knowing way, said, great, then let's just put this in our water. Let's start recommending this across the board to everyone because we really want to eradicate tooth decay. And so they really wanted to eradicate tooth decay. Unfortunately, it's not happened. That hasn't happened since we started adding fluoride to all of our tooth care products, to all of our water, to all of our everything. It hasn't happened. But there have been some side effects that have happened, including brittle bones. Because what fluoride does is it actually changes the structure of something called hydroxyapatite. That's the mineral that you see when you look at a tooth. That's called hydroxyapatite. It's also the mineral that makes up your bones. Fluoride bullies out calcium, pushes calcium out of that crystal and takes its place and creates something called fluorapatite. Fluorapatite is harder and more brittle than the regular tooth and bone structure. So in teeth, it's kind of okay because there's a cushiony layer underneath the mineral layer, but in bones, it's not. So they're seeing much higher rates of hip fractures and things in areas that have high fluoridation because it's changing the bone structure as well as the tooth structure. And this is what they forgot to tell us. Not only that, but fluoride is in the same place. If you look at the periodic table, you'll see that fluoride is right next to iodine, bromine, chlorine. They're all what are called halides, and they're all cousins. Well, thyroid hormone is activated by iodine. Fluoride is its bigger bully cousin. So it will actually push iodine out of the receptor sites on thyroid hormone. So you'll get a thyroid test. You'll say, gosh, I feel tired. I don't know what's going on. I must have low thyroid. You get a thyroid test and they say, nope, your levels are fine. What they can't detect is that the thyroid hormone has been activated by fluoride, not by iodine. So it's unusable to the system. So they're calling this type 2 hypothyroidism, where it's been activated by fluoride, unusable, but yet you still have symptoms. So now how many people do you know that have low thyroid levels? Largely related to fluoride use. And then the super scary one is they've done research to show this has actually been researched, and it is like PubMed standard research showing that IQ levels have actually dropped with high fluoride levels because it's affecting calcification in a special gland called the pineal gland in the brain. It calcifies it, leading to changes in brain function and an acceleration and rapid move towards Alzheimer's and dementia. So basically, fluoride has no purpose for use because this is what I always tell everybody. A cavity is not fluoride deficiency. That's not what happened. That's not what caused a cavity. It's not fluoride deficiency. There wasn't fluoride there to begin with, and then you just lost it, so you need more. It's not like, oh, I'm vitamin D deficient, I need to take more. A cavity isn't fluoride deficiency. There was no fluoride to begin with. What was there to begin with? Minerals, calcium. So if you have a cavity, what it means is that your body is taking those minerals to use elsewhere because you don't have enough. Or you're eating a lot of acidic foods. Sodas, all those kinds of things are very acidic. They will just pull those minerals right out. That's what acids do. That's why you dump a Coke on like your battery terminals and your car battery, because it eats away all of those minerals. That's what acids do. So they do it to your teeth too. So if you've got a cavity, it's because you're eating sugar, which is true because sugar feeds the bacteria, which dump the acid on the teeth. So then it dissolves your tooth. You're eating too much acid, or your body's taking the minerals to use elsewhere. So in all those instances, what do you do to fix it? You add minerals back. You don't have fluoride back. It's not a deficiency of fluoride. You just add minerals back. So now what I've done is I've actually formulated 2 products that have hydroxyapatite. Remember, it's the mineral you see. I have a tooth powder that has hydroxyapatite to add it back in. I have a whole remineralization supplement line that brings minerals back into the body and into the teeth so that you don't have to pull from them. And I also have a rinse that has hydroxyapatite in it. So my goal is that we really do eradicate tooth decay, but it's not from fluoride. It's because we can put back what was lost, what caused the cavity to begin with. So that's why we don't do fluoride. I think that causes all sorts of other effects that are undesirable. It may harden teeth, but we have something that hardens teeth just as well, if not better. Actually, research shows it's just as good, if not better than fluoride, and it doesn't do all the other harmful things.
It's such good information. And fortunately, I learned this a long time ago. My daughter had some cavities, and I took her to a holistic dentist, and he said that they can remineralize, and they did. And I have not been using toothpaste that has fluoride in it for a very long time. In fact, I make my own. And every time I go to the dentist, they'll say, well, this is boring because there's nothing going on here, which I'm so grateful for.
Yep.
But if you guys don't want to make, and most people don't want to make their own, and so
Yeah.
you can go on her site and you can grab some of hers. Is it back in stock? 'Cause I know it was out.
Yeah. It's back in stock.
Back in stock. Okay, so I'm going to tell you a little story, and this is how I found out about Dr. Jorgensen. A friend of mine has celiac, and she has a lot of problems with her teeth. She had heard about her remineralizing toothpaste, and she went on there and she got it. I don't know any of this at this point. I don't know any of this. So we're sitting down, I'm getting ready to leave, and I had noticed how white her teeth were. And I said, Valerie, what are you doing? Like, your teeth look great. They're so white. And she goes, are you kidding me? And so she said, this lady that I follow on Instagram, and I started using her toothpaste, and she said, it's only been a short amount of time, but for you to, so her teeth had whitened within 2.5 weeks of using that. And so she's like, that's just a testimony that it's working. So I thought that was really exciting. That was really neat. And you also, I wanted to snag your mouthwash or mouth rinse. I don't know what it's called, but when I got on there, it was out of stock. So I'm happy to hear that it's back in, so I can hop on there and get some of that. Well, I want to thank you again for your time and sharing all of this very, very important information with us. I want to thank you, viewers, for watching, and I know that you could be doing a multiple other things, but you decided to tune in and listen to this amazing information. So if you don't mind, give a like. Let us know what you're doing. Is this information new for you, or maybe you have some information that you would like to share with us as well? If you don't mind, give a little click on the subscribe button for more. All things health is what this channel is about. So you guys have a great day.